All right, you're welcome. Blossom, you're welcome. Kay, Mary Rose, Eunice Samuel, you're welcome. We are starting at exactly 8 p.m. You're welcome. Please share the link to your friends, to your contacts, invite them to join. Today we are looking at we'll be looking at pharmacology, actions and uses of medicines. Today we'll take a look at cardiovascular system drugs. Cardiovascular system drugs, drugs that act in the cardiovascular system. So that's what we are going to look at today. We'll start from where we stopped in our classwork. Today we'll start from the diseases of the heart. At exactly 8 p.m. we'll start. Thank you for being with us. Thank you for joining. And you're welcome. Big Money, you're welcome. Please like this, share with your friends, invite them to join. Please, for our full lectures, please visit our YouTube channel. The channel name is Pharmacology the Schoolboy. On getting to the channel, just go straight to the playlist. You see categories of different subjects, different courses. You see English, mathematics, chemistry, physics, as many subjects as you are interested in. You see lectures in all these subjects. The YouTube channel name is Pharmacology the Schoolboy. Pharmacology the Schoolboy. So if you follow us on subscribe, the channel name is Pharmacology the Schoolboy. Pharmacology the Schoolboy. That's YouTube. It is also the same for Facebook. Our Facebook name is also Pharmacology the Schoolboy. We have just 10 minutes to 8. Once it's 8 p.m., we'll start. Lecture is going on. If you have any question, please drop it on the comment section. If you have any question, please drop it on the comment section and we'll attend to it in due time. It may not be now, but we will definitely attend to your question. Please share this live link, share with your friends, share with your contacts, invite them to join. Please follow me on TikTok at FarmEternity83 at FarmEternity83. Also follow me on Instagram at FarmEternity83, on Twitter at FarmEternity83, on LinkedIn just Pharmacology the Schoolboy. And God will bless you as you do so. Snapchat at Pharmacology83. And God will bless you as you do so. Okay, we have 9 minutes to go. 9 minutes to go. We are counting down. Sammy Bams, you're welcome. Victoria Solomon, 32, you're welcome. I am Cynthia, you're welcome. Camilo Ismaila, 24, you're welcome. Mulat, you're welcome. Like, share with your friends, invite them to join. Please, as we wait for the lecture to start, you can quickly go to YouTube and subscribe. You can quickly go to YouTube and subscribe. The channel name is Pharmacology, the schoolboy is on the board. Just click on the red button and the subscribe. Then click on the bell like button, a button that looks like bell for notification. Whenever we post our full lectures, you'll be one of one of the first people to watch the lecture. Diana Rivers, you're welcome. Cheesy for Life, you're welcome. You're welcome. Today we'll take a look at pharmacology. Take a look at pharmacology, actions and uses of medicines. How medicines work in human body, different painkiller, you're welcome. As if you know we want to talk about drug today. Painkiller, you're welcome. Renaud, Lisa, you're welcome. You're welcome. Painkiller, I like your name, Painkiller. You're welcome. Okafor Ekeledu, you're welcome. Kelechi 0766, Zubi Sops, you're welcome. Painkiller. Okay. Okay. Please, as we wait, we just have 6 minutes to start today's class. As we wait, please quickly rush to YouTube to subscribe to our YouTube channel, From Eternity the Schoolboy. Also go to Facebook, like our page on Facebook, From Eternity the Schoolboy. Five minutes to go. Okay. God's favor, you're welcome. Momsi, you're welcome. Momsi Mohammed, you're welcome. 99 Monster for ML, you're welcome. God's favor, you're welcome. Pinkler, thank you for liking the live. Betty Rosaline, you're welcome. Wow. Pinkler, thank you for sharing. Thank you for sharing. God bless you. Betty Rosaline, thank you for liking the live. And my MC, you're welcome. We have 4 minutes to go. 4 minutes to go. Okay, the topic is cardiovascular system drugs. Specifically, today we're entering the diseases of the heart. In our last lecture, the part 1 is on YouTube. The full lecture is on YouTube. The part 1 of cardiovascular system drug is on YouTube. You can go there, you can watch it there. So this is the part 2. In that part 1, we discussed the anatomy and physiology of the heart, because you cannot be talking about drugs, how drugs act on a particular part of the body without even knowing the anatomy of that part of the body and the physiology of that part of the body. So once you go to YouTube, just search for the cardiovascular system drug part 1. You'll see it is there. Even the preview is on TikTok. The preview is on TikTok. Cardiovascular system drugs part 1 is on TikTok. Joy Johnson, you're welcome. Judith Nice, you're welcome. You're welcome. So we'll continue. This is the part 2. We'll continue from where we stopped, but specifically we are entering the diseases of the heart. Disease of the heart. So we just discuss 1, 2, 3 of them. Then we go to treatment, drugs. Scott, you're welcome. Ojeta Tracy, you're welcome. We have 2 minutes to go. 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 So in that first lecture, we discussed the structure of the heart, the 4 heart chambers, and the how blood enters each of them and their relationship with the lungs. That's what we discussed, and we talked about the anatomy, the position where the heart lies, and these are the things we discussed in the part 1 of this lecture of this topic, cardiovascular system drugs. So we have just 1 minute to go. So as I said, I have all our full lectures are in our YouTube channel. The channel name is Pharmacology, the schoolboy. If you go there, you see a lot of lectures. Just go to the playlist, and it is categorized according to the subject. You see different subjects. You see English, you see mathematics, you see physics, you see dispensing, you see pharmacology, you see pharmaceutical calculations. Any of the subjects you are interested in, click on it, and you pick any topic of your choice, and by the special grace of God, with time, we keep adding more and more and more. So it's 8 o'clock. So let's go to what we have today. Well, this is not cleaning well. Let's go to what we have today. It's 8 o'clock. Okay. The course code is actually is 321. 321. Today's date is 27th March 2024. So the topic is cardio. So cardiovascular system drugs, part 2. Cardiovascular system drugs, part 2. So you're welcome to our today's lecture. Today we'll take a look at AUM 321, actions and uses of medicines. And the topic is cardiovascular system drugs, the part 2 of it. In the part 1 of this topic, we discussed the heart, the functions of the heart, the structure of the heart, the chambers, and how blood enters the heart and leaves the heart, the relationship of the heart with the lungs, and what actually happens when blood enters the lungs and when blood leaves the lungs back to the heart, and from the heart to the systemic circulation. And we talked about the valves guarding each of the chambers of the heart, and we also discussed the role of these valves in preventing blood from going back and what have you. These are the things we discussed in the first lectures. Please, the part 1 of this lecture is on YouTube. You will see the preview on TikTok. You go to YouTube, it's cardiovascular system drugs part 1. You watch the full lectures. Please, as lectures go, if you have any question, feel free to drop the question. we'll attend to it, if not now, later. So today we are going straight to another aspect, because in that lecture I told us that you can never talk about the pharmacology or drugs of a particular acting in a particular system of the body without understanding the anatomy of that part of that system, the physiology of that system, the pathology, that is that the abnormal or diseased, when that part of the body is or system is in a diseased state. If you don't understand what happened and how it happened, you will not be able to know how the drug will be able to correct the issue. So today we go into the diseases of the heart. Actually, there are three commonest forms of disease of the heart. One of them is hypertension. Another one is congestive heart failure. Then the next one is what? Coronary artery disease. You know this with the question, it says cardiovascular system drug. So specifically, we are looking at heart disease itself. There are other diseases that has to do with cardiovascular system, but we'll start with these three, then take it step by step and see how far we can go. So we just have 1 hour in this lecture. At 9 p.m. we thought we'll stop. So that's why I want to take it step by step. Then let's look at hypertension. I mentioned the three commonest diseases of the heart. I mentioned hypertension, congestive heart failure, hypertension. This is, you can present this with this. Okay. We have hypertension, congestive heart failure, and coronary artery disease. HTN, CHF, and CAD. CAD. Okay, now let's go into hypertension. What is hypertension? Hypertension is nothing but a sustained elevation of the systemic arterial blood pressure. When there is a sustained, one or two things may cause the blood pressure to rise. Instantaneously it may rise. That doesn't mean that it's what? That the person is hypertensive. It may rise because of the situation on ground, and you may say come down. But if there is a sustained elevation, sustained over a long period of time of elevated blood pressure, then there is a problem. Now, what is this blood pressure we are talking about? What is blood pressure? You know, from our physics, we define pressure as what? Force per unit what? Area. You know, as the blood passes through the vessels, there is this force with which the blood collides with the vessels. So this force per unit area of the vessels it touches is what is called what? Blood pressure. Now, what is now blood pressure? Standard definition. Blood pressure is the force of the blood against the what? The vessels, or the arterial, specifically the arterial walls. When the heart beats, that is in systole, and when the heart is relaxed in diastole. I repeat, blood pressure can be defined as the force of the blood against the arterial wall, when the heart beats or contracts, as case may be, in bracket, systole, and when the heart relaxes, diastole. This informed our having systolic blood pressure. So systolic blood pressure is the pressure when the what? In systole, when the heart beats or contracts. While diastolic blood pressure is the blood pressure in diastole when the heart relaxes. Good. Now, each of these has its own normal value, and the value at which it will exceed, it becomes an issue. Remember, elevated blood pressure, sustained or prolonged elevation of the what? Blood pressure. Okay, let's continue. All right, so the blood pressure here is measured in millimeter mercury. Millimeter mercury. Millimeter mercury. That's the unit we are using. In millimeter what? Mercury. Hypertension is a silent killer. It is a silent killer. And it's a very serious what? Problem. Sometimes the patient may not even realize, the person may not even realize that he or she has this disease until the signs and symptoms will start manifesting. And what are these signs and symptoms? You start seeing things like symptoms specifically. You start seeing things like severe headache, chest pain, irregular heartbeat, irregular what? Heartbeat, even fatigue. Fatigue. Now, there are risk factors that will predispose one to having this what? High blood pressure. So there are risk factors for high blood pressure. These factors are as follows. Number one, obesity. Obesity can lead to what? High blood pressure. High sodium what? Diets. Some of us, when you want to eat, if we don't put salt, because salt, our table salt is sodium chloride. If we don't put salt, we will never eat. Even after putting salt before while cooking the food, we'll add extra salt. It is not a good thing. Now, high intake of salt is a risk factor. Is a risk factor. So is a lifestyle you need to modify. Diet you need to modify to be able to run away from what? High blood pressure. Even lack of physical activity. If you don't exercise your body regularly all the time, you are one place, you are not working out. Maybe the nature of your job around that you stay one place. You want to go from here to here, you enter a bus or enter a bike, or you must use your car. Whatever time you walk or exercise or work out, these things predisposes one to what? High blood pressure. Then stress can also cause that. Stress can also is also a risk factor. Even alcohol, excessive alcohol intake. Genetics. It can also be what? Hereditary. Yes. It can also be hereditary, can transfer from one generation to what? Another. There are people in their bloodline, see that you further that they have, just as you have, this also happens in the diabetes mellitus. There are people that is in their bloodline, they will have it. The father had it, the grandfather had it, the father had it, the person also having it. So anybody that has such in the bloodline should mind his or her what? Lifestyle and even diet. Very, very what? Important. Even age. Yes, even though yes, these days you see children with hypertension. Yes, but on a general note, generally above 35 years of age, it to start manifesting. Then even race Race, yes. Race. African Americans have been at higher risk of what? Having high blood pressure than any other racial group. African Americans. So this hypertension, people with hypertension, if they don't take care and if proper treatment, if not properly managed, can lead to other complications like heart diseases will come up. Other heart diseases will come up. Yes. Even liver failure, name them, heart attack, even stroke can come in. Even diabetes mellitus. There are these comorbidities that exist between hypertension and the diabetes mellitus. Now let's continue. Okay, so this is basically at this level of the course we are treating, 321. This is for pharmacy technicians. At this level, this is what what you can take for now. We'll keep going. I want to say one or two things about cardiovascular, about congestive heart failure. Then after that, then mention one or two other heart diseases before we go into drug treatment. That's what I want to do now. Okay, another heart issues I want to talk about is what? Heart failure. Heart failure. Basically, when we discussed the anatomy and physiology of the heart, we saw how the heart blood enters blood from the lower limb up, from the head down, drain through the veins into the superior vena cava, those from the head, from the leg, abdomen, and coming up, drain into the inferior vena cava, and how they enter the right atrium, and how the right atrium pump them to where, and how they enter the pulmonary artery, and from pulmonary artery they enter the lungs, because those ones are exhausted. There's no oxygen content is low, filled with CO2 and other waste. They enter the lungs. From the lungs, they are now oxygenated again, and from the lungs they will now come up and enter from the lungs to the pulmonary vein. They will enter the left atrium, and from the left atrium, of course, from the right atrium they enter the right ventricle. Sorry, before they enter the pulmonary artery, but they must pass through the right ventricle. Now, on coming out from the pulmonary vein, they will enter the left atrium, the left ventricle, and they will be pumped into the aorta. From the aorta, they are distributed to other part of the body. This whole thing is going on. As this thing is going on, the heart is busy, functioning well, pumping this blood. But in heart failure, the heart finds it difficult. The ventricle specifically and the atrium find it difficult to pump out this blood presented to them. And when they fail to pump the blood presented to them, what will happen? That the blood will remain in in those chambers. And when the blood remains in those, the output, the one that they will pump out, will be small. And the muscles will be stretching in order to doing more work against the accumulated blood there, forcing itself to pump this blood. As it's doing that, the heart, those chambers are having issues. They are becoming distended with more blood. Because as this is going on, more blood are entering, and they cannot be. As time goes on, other things will set in. Pulmonary edema, a lot of things will set in all over the body, and it's a problem. That's why people with congestive, you see them having edema, because there's accumulation of fluids. There's accumulation. Note that point. There's accumulation in congestive heart failure. So this is basically what happens in congestive heart failure. So congestive heart failure is not something you play with. It's not something we play with. All right, let's continue. Okay, so then what then is congestive heart failure? So now let's go. Of course, now when the cardiac cycle in congestive heart failure, the heart fails to cycle all the blood it receives. So it's caused by what? Decreased contractility. The heart, that contractile function of the heart is decreased. So it cannot contract to pump out this blood. So it is caused by what? A decreased what? Contractility of the what? The myocardium. Myocardium, the muscles of the heart. So what happens is that the heart keep receiving more blood without pumping out blood. That's what happens. So when this happens, the myocardium is now more pressure, more work is being presented toward the myocardium. So even the valves will start having issues. The valve will start what? Having issues. So this whole thing as to go on, the blood will do what? Accumulate. It can even lead to what? The enlargement of the heart. Enlargement of heart will even set in. You start seeing hyperplasia, hypertrophy, and other things will start coming up. Okay, let's continue. So when this enlargement takes place, it weakens the heart muscles. The heart muscles will be what? Weakened. So the heart does not stop. Remember, the SA node is still doing its work, trying to electrical impulses coming in, traveling down to AV node. The bundles and the Purkinje fibers are still doing their work, trying to stretch, trying to. The heart is doing more work, compressing, trying to push this blood out. As the heart is trying to do more work against this accumulated blood, the muscles are becoming weaker. All right. So this is what happened in what? Basically what happened in what? Congestive what? Heart failure. There is something I didn't mention in the hypertension. I just talked about it, but I think it's necessary I mention these things. What and what? We have different stages of hypertension. Sorry, I missed that. And I want to talk about the blood pressure, different stages of the hypertension, and the blood pressure that we attain. You know that this person is at this stage of what? Hypertension. Now, the first one I want to talk about is the first stage is the normal. In normal, remember we have the diastolic blood pressure and systolic. I've explained them here, diastolic and systolic. Diastolic blood pressure is the pressure of the blood when the heart works, contract or beat, while diastolic blood pressure is the blood pressure when the heart relaxes. Now, the normal blood pressure for systolic is what? Above 120. For diastolic, above 80. So, for normal blood pressure, diastolic blood pressure and please note this conjunction, diastolic blood pressure and systolic blood pressure 120 above and the diastolic 80. Systolic 120, diastolic and the diastolic 80. Please note this conjunction. And is not all. And 80. So we have the normal pre-hypertension, stage 1 and what? Stage 2 hypertension. So we are talking about the normal. Systolic 120 and the diastolic above 120. Now, pre-hypertension, systolic 120 to 139 millimeter mercury. Systolic 120 to 139 millimeter mercury. Or, not and now, or diastolic 80 to 89 millimeter mercury. Pre-hypertension, once your blood pressure falls between 120 and 139, is pre-hypertension. It's pre-hypertensive stage. And or either of them, if either of them, if systolic is fall between 120 or 1 and 139, or diastolic 80 to 89, there's one, and it's a pre-hypertensive state. Then Stage 1 hypertension. Systolic 140 to 159, or diastolic 90 to 99. Systolic 140 to 159, or diastolic 90 to 99. Either of them, any of them that has this, then is stage 1 what? Hypertension, irrespective of whatever the other one is. So far, one of them has reached, one of them has reached this limit, and there's an issue. Then stage 2 hypertension, the systolic 160 and above, or diastolic 100 and above or higher. Systolic 160 or above 160, diastolic 100 or above 100, any or not. And now it's only in normal you see and, or if any, or maybe your diastolic may be, if your diastolic, like, let it be 120 and your systolic is 100, is a sign that is stage 2 hypertension. That's the point I'm making here. So please let us note this, okay? I don't want to go beyond the scope, start talking about JNC7 and JNC8. It's okay, but let me just limit myself at this level, okay? All right, let's continue. So these are what I want to say on this hypertension and what? Congestive heart failure. The other ones, as you see things like okay, let's look at symptoms of congestive heart failure. What are the symptoms? We have anxiety, we have restlessness, then the patient is always bluish, cyanotic, very important. Cyanotic skin, see that pale skin, even clammy skin, and persistent cough, very important. Because of the congestion, the edema. Remember that more blood leaves the lungs to enter to the pulmonary vein, to the left atrium. If the left atrium, through which blood enters the left ventricle, to be pumped to the aorta, if the ventricles could not pump, there will be what? Backlog of blood and fluid, even back to the lungs, and the edema will set in. Pulmonary edema will set in. The patient will start having cough, persistent cough, very, very important. Even rapid breathing is also one of the symptoms. Fast heart rate. Of course, I've mentioned edema, swelling, even in lower limbs, because the blood that we are meant to come back to enter through the inferior vena cava to the right atrium, through which it will enter the right ventricle. The right ventricle could not pump, so there will be accumulation in the right atrium down the limbs. So it's a very serious thing. So congestive heart failure is very serious. So there is edema of the lower limbs. Very important point to note. So these are a few of the symptoms of congestive heart failure. If you start going deep, into the compensated heart, and let me not go there. I'm limiting myself to this. So let's continue. So ischemia is also an issue. So what is ischemia? Basically, on a general note, ischemia has to do with shortfall of oxygen-rich blood. When oxygen-rich blood fail to get to certain part of the body, that part of the body will become ischemic, because the oxygen-rich blood could not get to that point. Either it is blocked, or it is stopped, or it's restricted, as the case may be, to that part of the body. That part of the body becomes ischemic, and is a very serious problem. So when this ischemia occurs in the heart, cardiac ischemia, what happens? So cardiac ischemia is nothing but lack of blood flow and oxygen to where? To the myocardium. Cardiac ischemia, lack of blood flow and oxygen to the myocardium. So, of course, when this happens, on the temporal note, you start having things like angina pectoris. Angina what? Pectoris. Pain in the what? Chest and heart area. Pain in the chest and heart area. There's always a mix up between this pain and that one that comes from where? Ulcer. There's always a what you can use to distinguish them. But the point there is that when there is deprivation of oxygen-rich blood to the myocardium, on a temporal note, you start having what? Um, um, angina pectoris, pain in the chest and the heart area. Then, but if this is sustained, over a long period of time, it becomes a very serious, more serious problem. It leads to what is called myocardial infarction. Myocardial infarction. The first one is what? Angina pectoris. Myocardial. Infarction. This one is just temporary, but this is when this is sustained for a long time. It leads to what? Myocardial infarction. So this will now usher us to what is called what? Myocardial, not cardiac. Myocardial what? Infarction. This one now is serious, leading to serious tissue damage, even death. Heart tissues, damage of the heart tissue. So let's look at this myocardial infarction. So what is myocardial infarction? So it occurs as a result of what? Ischemia. So the result of ischemia is damage. Of course, I've talked about that. Damage or death of the tissue. When it keeps over a long period of time, do not receive oxygen because, of course, what does oxygen do? If you go back to tissue, cellular respiration at the cellular level, you know what oxygen does. Oxygen break down the nutrient to release what? Energy. And that energy is what the cells, of course, the cells make up the tissues. This myocardium we are talking about is a tissue. And this muscle, their tissues, down there we have muscle cells. So these cells, in fact, they are active. They need energy. The mitochondria there in the muscle cell is small because they need more energy because of the work they do. So if oxygen is not supplied, there's a problem because there will be no breakdown of the nutrients, and the there will be no release of energy in the form of ATP for the activities of these muscles. So they will start dying one after the other if oxygen-rich blood doesn't get to them over a prolonged period of time. All right, so that's exactly what happens. So when they don't receive enough energy, enough oxygen, they will do what? They will die. So if this necrotic, of course, when you say that the tissue is necrotic, that is dying, a dying tissue. If this necrotic tissue is in the heart, of course, we are discussing the heart or the cardiac muscle, then it becomes what you call infarction. Basically, not just the muscle cells or the muscle tissue. If any part of the body where oxygen fails to go, that cell will start dying. Normal. So, but if it's in the heart, you call it what? Infarction. Heart muscles call it what? Infarction. So that's where the name comes from, because they become necrotic. All right, let's continue. There's a point I want to make here. Tissues that have undergone myocardial infarction will never heal or return to its status of its normal or the functional muscle. So once a particular cell or tissue undergoes myocardial infarction, you never what? Heal again. So let's know that point. So what it means is that the heart muscle keep reducing at each MI, myocardial infarction. The heart muscles keeps reducing. There's nothing like healing and coming back to your own initial state before. No, that one is gone. That one is gone. So that's the point we are making here. Okay, this is basically what happens in what? Myocardial what? Infarction. Okay, let's take a look. Let's just go through arrhythmia. If you watch, I've not started talking about treatment. I'm just mentioning these disease states. I've not entered into treatment. Now let's talk about arrhythmias. Then what is arrhythmias? What is it all about? Arrhythmias. Arrhythmias. What is it all about? Arrhythmias. Sorry. Arrhythmias. Arrhythmias. Remember, in our first class, we discussed the heartbeat. Beating, each contraction represents one heartbeat. So, these heartbeats follow a regular pattern. So, if it becomes irregular, it can be faster than normal, it can be slower than normal. Arrhythmia has setting. If it is faster than normal, if it's lower than normal, arrhythmia has setting. So it can be tachycardia when it's faster than, it can be bradycardia when it was slower than how it should be. So basically, arrhythmias are what? Irregular patterns in the beating of the heart, or simply a change in the force of or speed of heart contraction. Remember that heartbeat and contraction are talking about the same thing. So if there's a change in the force or speed of contraction, or simply change in the pattern of the heartbeat, arrhythmias have set in. So it can be faster, can be what? Slower than normal. Remember that the normal heartbeat is 60 to what? 100 beats per minute. Heart rate, 60 to 100 beats per minute. All right, let's continue. So this is basically what we mean by what? Arrhythmia. So if we have slow heartbeat, there is known as what? I think I mentioned that. Bradycardia. Fast heartbeat known as what? Tachycardia. Okay. So what actually happens? This arrhythmias can occur where? In the atrium, can occur in the what? Ventricle, can even occur in both of them at one time, or even at intervals. So it can result as it can occur as a result of what? Heart diseases, other cardiac diseases such as CHF. Because when there's when we have congestive heart failure, a lot of changes that the contraction will not be as it used to be. Of course, there will be change in the pattern of heartbeat. So congestive heart failure can cause what? Arrhythmias. Even coronary artery disease. We also talk about coronary artery disease. That one is just, that the heart itself has arteries. Coronary artery disease. The heart itself has its own artery that supplies it. So when there's a disease, when this artery is diseased, then talk about what? Coronary artery disease. Coronary artery is just the artery that supplies the heart itself, not the heart itself. Blood supply to the heart itself is through the coronary vessels. Okay, let's continue. So even hypertension can cause it. Yes, hypertension can cause it. Myocardial infarction can cause it, and what have you. Even some side effects of some drugs can cause what? Arrhythmias. Okay, so so a very important arrhythmia that is the most serious of them all is the one we call ventricular fibrillation. Ventricular what? Fibrillation. This one has to do with what? The ventricles. Remember, the ventricles are very, very important, whether be it right or be it left. Be it right or be it what? Left. Anything that comes that affect the ventricles is a very serious issue. Okay, so at this juncture, I want to really go into pick the drugs for this measure, this thing I talked about now. Look at the drugs for management of these things. I mentioned the drugs, the class the drug belong to, then talk about the dosage from how it comes. Does it come as tablet? Does it come as syrup? Does it come as injection? And talk about the dose, the strength, in how many milligrams does each of these drugs come? And we also talk about the dose, the dosage. So let's just look at let's look at this group of drugs first. Let's look at this group of drugs first. I will list some drugs, then take it one after the other. Excuse me. Okay, I'll list some drugs, then we'll take them one after the other. So let's look at these drugs. I will list them. First of all, look at the cardiac. There's a group of drugs we call cardiac glycosides. Cardiac glycosides. We look at cardiac glycoside, diuretics, cardiac glycosides. We look at diuretics. Then we look at diuretic. We look at vasodilators, ACE inhibitors. Look at diuretic. We look at vasodilators, ACE inhibitors. Then we look at beta blockers. Then we look at angiotensin receptor blockers. Let's just then phosphodiesterase inhibitors. Phosphodiesterase. Which one have I not mentioned here? Okay, let's work with this. Then we add more. Phosphodiesterase inhibitors. Now let's look at cardioglycosides. What are these cardiac, not cardio? Let's look at cardiac glycosides. Is that what I wrote here? Cardiac. Okay, cardiac glycosides. Now, what are these cardiac glycosides? You know, in congestive heart failure specifically, in congestive heart failure, we mentioned that contractility becomes a problem. More work is done by heart trying to the heart ventricles and what have you trying to contract against accumulated what fluid. They are distended and are trying to do what? Contract. So more work. But this glycoside helps in this what? Contraction Of course, when more work, when the heart is doing more, the muscles is doing more work to contract, oxygen consumption will do what? Increase. Yes, more work. Remember what the oxygen does at the cellular level. Muscles of the heart are one of the tissues where you have a lot of what mitochondria because of the work they do. So more oxygen is required. But when it is tended, more than normal is required. So there's increased oxygen consumption. But this cardiac glycoside will achieve this without increasing the oxygen need demand, oxygen need of this muscles. So it will increase contractility, muscle contraction, to be able to pump out blood at the same time without increasing the oxygen consumption. So that's basically what they do. An advantage of this cardiac glycoside. So cardiac glycoside are used to increase the force of myocardial contraction without causing an increase in the consumption of oxygen. So these cardiac glycoside are basically they are derived from plant we call digitalis. So we have the one we call digitalis purpurea and digitalis lanata. Digitalis lanata and digitalis digitalis purpurea. These things are Latin words, so they are Latin words. So we have digitalis purpurea and digitalis lanata plants. They've been used for hundreds of years because of their glycoside they contain. So they increase blood flow. Of course, the contraction aid them to increase they also they increase blood flow. Even they also increase kidney filtration. So what is the effect of this increasing the blood flow and increasing the kidney filtration? What here happens is that it will help to do reduce sodium and other electrolyte that cause fluid retention. Remember, there's retention of fluid in congestive heart failure. So they work on the act, everything they do to reduce that sodium and other electrolyte that will lead to things like chloride, that will lead to fluid retention. That's basically what they do. Of course, in everything that happens, apart from that, they also cause exchange of this sodium with calcium. Remember the function of calcium in contraction. So this sodium retain will see the exchange with calcium. Of course, it will also act on the sodium potassium ATPase pump to shut down the sodium removal. So when this happens now, the sodium will now be exchanged with calcium, and calcium will now be there to do cause increase contractility. Fluid retention is avoided. Calcium that enters will be there to do cause increase in contractility. So as it's tackling preventing fluid accumulation, at the same time contraction is also aided. So this whole thing will help the heart to be able to contract without leading to more oxygen consumption. So this is basically what happened with cardiac glycoside. Example of this cardiac glycoside is typical example is digoxin. The typical example of this cardiac glycoside. We go to this digoxin in detail. We'll talk about the dose, how it comes, and the strengths it comes. All right, so now let's look at the effect of the electrolytes. These electrolytes, these ions, with the what? The effect they have on this what? On this what? Glycosides. Now, when there is, for patient with hypokalemia means low level of potassium. Hypokalemia. Sorry, my I was busy teaching without even knowing, that the life, the thing stopped, disconnected. I don't even know where I stopped. I don't even know where I stopped. Please, if you miss out some things, please bear with me. I just discovered that the thing disconnected. I don't know what happened. So I was saying that for cardiac glycoside, hypokalemia increases the absorption of cardiac glycoside, thereby leading to what? Increase in bioavailability, therapeutic effect, but increase in the toxic effect. That's the final effect, that it will increase the toxic effect of this. You know that these drugs are potent drugs, that they have narrow therapeutic window. Yes, very important. Narrow therapeutic window. So the toxic level can easily be reached. So that's a very important point we should note here. Then hypercalcemia, high level of calcium in the serum. Hypercalcemia also increases what? Absorption of what? Of what? Cardiac glycosides, thereby leading to increase in what? Therapeutic effects. Good. Of course, there will be also an accompanying what? Toxic effect. But hyperkalemia decreases its absorption. So this will help you when you want to place a patient on this drug. You know how to go about it. And remember, I said that treatment with this cardiac glycoside is what? Is individualized. So we are going into what is called what? Digitalization, where you have something like a loading dose. You load a particular dose, then you start with a particular dose, then with time, subsequently you now maintain at what? Almost 1/4 of the what? Dose of the dose you started with. So that's how you do and monitor the patient to avoid what? This what? Toxic effects. Okay, so that's basically what we said here on before the thing cut off. I don't know where the thing cut off. I don't know until I will find out when I'm done with the lectures. So I just went to check and discover that thing cut off. Maybe network. I don't know. So that's basically what we'll be saying here on these cardiac glycosides. And I said that, and a typical example is what? Digoxin. I think yes. I think that's where I stopped before I went to check. Digoxin is the what? A typical what? Example is what? Digoxin. So I say that, remember I say that the digoxin is example, the cardiac glycoside example, digoxin doses is what? Are highly what? Individualized. So you can start a patient on a very high dose, then maintain it what? To about 1/4 of the what? The dose as what? Maintenance dose. So this process is called what? Digitalization. So you can use to achieve a rapid blood level, then you now start to deliver it and maintain a particular level. You taper it with that what? Level. So that loading dose may be the maintenance dose may be around 0.125 milligram to 0.5 milligram per orally every day. 0.125 milligram to what? 0.5 milligram. Okay, so we can also have this digoxin can be presented as what? You can have it as what? Capsules. You can have digoxin as capsules at the strength of 0.5 milligram, even 0.1 milligram, 0.2 milligram as capsules. 0.5 milligram, 0.1 milligram, 0.2 milligram. You can also have it as what? Tablets. You start seeing things like 0.125 milligram, 0.25 milligram as tablets. 0.125 and 0.25 milligram. You can also have it as what? As what? Elixir for children, pediatric elixir for children. You can have it as what? At the strength of 0.05 milligram per ml. As elixir for children, 0.05 milligram per ml. You can also have it, the popular brand is Lanoxin. You can also have it as injection. You can have it as injection, 0.1 milligram per ml. You can also have it as 0.25 milligram per ml. These things are, so you can have it as injection, elixir, capsules, and tablets are different what? Strengths. Are different strengths. You're welcome back. Sorry for the break. You didn't know when the thing went off. You're welcome back. Hello, Pedro. You're welcome. Thank you for liking the live. Let's continue. Okay, so that's for the digoxin. So we also take a look at what? Diuretics. So our time has exhausted. We have exhausted our time. This is just a 1 hour lecture. Okay. I think I have more 10 minutes because I think I spent. No, I don't have time again. No, our time has exhausted. Wow. Okay. This is just 1 hour class. We'll stop here for today. From tomorrow, please, 8 p.m. tomorrow here, we'll start with diuretics. We'll discuss diuretics. 8 p.m. here, we'll start with diuretics. So we're entering cardiovascular system drugs at 3 tomorrow. So thank you very much for your attention. Please, for the full lectures, please go to YouTube channel. Our channel name is Farm Eternity, the School Board. Farm Eternity, the School Board. Farm Eternity. Let me write on the board. Farm Eternity, the School Board. Farm Eternity, the School Board. For our full lectures, go to our YouTube channel, Farm Eternity, the School Board. Subscribe and go to the playlist. Go to the playlist. You see different courses and subjects. Click any one of your choice and pick any topic of your choice and watch. Please share with your friends. Invite them here. Every evening, 8 p.m. we are here. During normal lecture period, morning hours, working day, we're also in class. In fact, always check this. Follow me on TikTok at Farmeternity3. Follow on TikTok. Check from time to time. We are one or some days we have up to 3 lectures, 4 lectures in different hours of the day. 4 to 6 p.m. we organize tutorials for O-level students. Then sometimes 3 to 4 p.m. we have pharmaceutical calculations and other courses. 8 to 9 p.m. we are also here in the evening. Morning hours we are also there. And God will bless you as you do so. See you tomorrow. Good night.